Good morning, everyone. Welcome to our second official summer session, our alternative integrative medicine. We're glad to have our participants here in our Oak Room as well as our Zoom audience. So thank you for being with us. Please hang in there for questions at the end. We will be recording this session, and I would like to introduce Pushpa Kalra, who will introduce our presenter and our session for today. Thank you.
Hello, good morning. Can everybody hear me? Okay, thank you. I'm Pushpa Kalra, and I want to welcome you to this session of integrative medicine or alternative medicine, which is what is alternative medicine is really medicine that people believe in, but that has not been tested rigorously or has not been approved by the FDA. So the pharmaceutical industry is not involved in this. A lot of these practices or herbs or things that people take do work, but because they have not had the stamp of approval, they're considered to be alternative. They're getting more and more acceptance with the medical community, and the field is now called integrative medicine. And our speaker today, Dr. H Neims, started really promoting alternative medicine in Gainesville. As far as I know, he was really the impetus to promote and develop alternative medicine, or at least to promote interest in it. Dr. Neims obtained his MD from Johns Hopkins, and he's specialist in pediatrics. In 1978, first he was in McGill University doing research there, but in 78 he came to UF, where he was the chair and professor of the Department of Pharmacology and Therapeutics. In 1989, he was appointed Dean of the College of Medicine, and he served in that position for 7 years. And then after retiring from the deanship, he went back to being professor of pharmacology. He's currently Professor Emeritus. His work has centered on the beneficial and harmful effects of drugs on fetus, newborn, and children. After retirement, he co-developed the Center for Spirituality and Health. He's very proud to tell us that he's just celebrated his 60th wedding anniversary. He's got 3 great kids and 7 super grandchildren. Alan, we're very happy to have you here in the storm, to have braved the storm.
Thank you very much. It's a strange thing for me today. First of all, I always worry about giving a talk like this because you have the believers and the non-believers about whether this is any good. And to convince either one is like trying to deal with a pro and con Trump. So you know I know ahead of time that I'm not going to convert anybody. All I want to do is share with you the perspective that I have of this whole area. And mostly through some interactions that I've had with people and experiences. You know, you get to be my age and you like to tell stories about your own life. And as my family often says, or my wife particularly, she says, no, I've heard that one 1,000 times already. And I get that. Okay. You know, and it is somewhat audacious for me to come and speak about this because I've never really done any of these alternative or complementary practices. I have done research with people who do them, and I have studied a great deal about what they are and what they can do for people. But I don't have that direct experience. I have taught at the Dragon Rises School for Chinese Medicine. I have done some teaching at the massage school in town, but most of the teaching they ask me to do is some Western medicine, our medicine approach because both require some knowledge of Western medicine for their certification and their testing. And it's been fun to very committed people that do that for being a good human being. So you run into a lot of people who aren't anti-science or anti-Western science, but they really want to do, they have a different attitude about health. I've spent my life, as Pushpal really described, as a scientist, a teacher of science, a medical practitioner. But so don't please, no one please interpret this as a pro-alternative set of talks. I'm not trying to speak against science or Western medicine. In fact, less than 200 years ago, median lifespan for human beings over most of the world was at best 45 years. That means that half the people were dead by the time they were 45 years old. Right now, we're approaching 80% median survival. We haven't made 80 yet, and COVID will drop it down a bit. So, and is this due to science? My attitude is sure it's due to science. That's what's really changed in this world. So I'm proud of what modern medicine and scientific medicine has done. But like a lot of great discoveries over the whole world, over radioactivity, hello, Ken, and all this advance in Western medicine has left a hole in medicine too. And I see this as another set of really good things that modern medicine doesn't quite jive with people's thought process in Western medicine. For example, your doctor's, rather than looking at you, looks at his computer or her computer. And that really bothers a lot of people. And it's nice if you're lucky to get a doctor that doesn't do that, but it's a problem. You know, in any case, I always feel I have the right to speak my mind about these things because my favorite line in college, I went to University of Chicago, with that great books course from last millennia. But the line I left college with was one from John Stuart Mill, the philosopher, which is, I'm sure I'm not going to get it exactly right, but if all mankind minus one were of one opinion, that man would have as much right to be heard as all of mankind. So these are attitudes, and you obviously will buy that or buy what I say, or you won't, and that's okay. Obviously, it's okay. Okay, let's go. The other thing I wanted to accomplish a little bit is I realized just from being around that a lot of people who aren't in this field don't know some of the gimmicks and games and words that people use all the time. Like, what is a dietary supplement? Why can you buy it? Is it the same as an over-the-counter drug? And it's wrong. And all this advertisement on TV about clinical studies show. All a clinical study means, it doesn't mean a randomized double-blind clinical trial. All a clinical study is if I give a drug or anything to a patient and observe them, I have done a clinical study. So some of the advertisements where you hear people promote something that doesn't seem at all logical, there are a lot of these little things. I'll try and hit as many as I can. Okay, what are we talking about? What is alternative or complementary or integrative medicine? I imagine for, I don't know, people have been around for what, 50,000 years or so, I think. And I would imagine even in the earliest groups of people, they tried to find things that would help heal or get rid of illness. So various cultures have developed their medical approaches. With us, even in more modern times, we're a country of immigrants. So people from all over the world have brought their home remedies here. They brought their healing systems like Chinese medicine or Ayurvedic medicine. They brought them here. So we have a start for this diversity besides Western medicine. The words that we use that you probably have heard are alternative, complementary, and integrative. This was an evolution of words. When this field first started, and it became big in this country in roughly the 1980s is when it started to get very common for people to use an alternative medicine. I'm not talking about home remedies here. I'm talking about an organized approach to various illnesses and diseases. But it was called alternative because in many ways, Western medicine did not accept it and poo-pooed it. So it was an alternative to going to your Western medical doctor. As it became more attuned to the dealing with Western medicine and vice versa, then the word complementary came in. So as opposed to being an alternative, it was a complement to what your Western doctor would recommend or give you. An example of that would be acupuncture. Acupuncture is only one not small, but one component of traditional Chinese medicine. There's all kinds of other parts to the medical system. And it was more acceptable. I mean, it became part of a doctor's thinking of some doctors a little bit. But then as Western medicine and Western business became more involved, it became integrative. So, and I can't exclude in any way the fact that business, second party payers, all of that came into making integrative a more acceptable word. So it's closer now to having a real union with Western medicine than it's ever been, like the integrative medicine unit at the University of Florida. There's been this big change in the words. There is no good definition of what is integrative and what is complementary or alternative. It's when you look up what a dictionary or something else would say about what are these practices, it says something that's meant for curing or healing that's not part of standard Western medicine. So I smile at myself and say, geez, I wonder in a country where another system is their standard of medicine, is Western medicine alternative or, so there's a lot of stuff that is not a clear set of events. In fact, you can find many papers that will list the most commonly used alternative medicine is prayer. Because it is not generally part of standard medicine. That doesn't mean that your doctor can't pray with you, of course, although that's been debated for a long time, even by the AMA. So there isn't a good one. What they include is they're the systems of medicine, whole systems by themselves. That's Ayurveda and traditional Chinese medicine, for example. There's all the spiritual ones, which include prayer, healing circles, parts of yoga, and just meditation of all kinds. There's guided imagery, where you perhaps remember the times when people said, you gotta imagine your white cells eating your cancer up or something like that. That's the guided imagery part. There's physical things like yoga, chiropractic, and then including closer to regular medicine, osteopathy and massage. There's all the nutritional stuff, the dietary supplements, the special diets, the detox diets, and even the coffee enemas. Then there are the psychoactive drugs that are sometimes taken by the patient, but sometimes taken by the healer. And I will talk about that in a second. Uh, there are, and that's, there are the sensory things like aromatherapy. There's the energetic rearrangement, floral essence being a classic one there. And one might even include acupuncture in that, although we don't quite know how it works. And then there's electrical stimulation. So the list goes on and on. If you have a definition that is anything but standard, it's going to be a big list. The story, there was a man named Fulton Cruz who was a faculty member at UF. And Fulton went with some folks, I think, from the College of Pharmacy, and they went up the Amazon. Fulton's an adventurous guy, and they went to look for shamans and learn from them and maybe find a drug. That's what they were really after, is to find something. And they had one very receptive village, and it was a woman that couldn't walk because of arthritis in her knee. And she came to the shaman, and then the guys from here, including women, guys is a generic term for me, they watched, and it began just as the sun went down, and they cooked up all kinds of herbs and things, and they had it under a low flame, Fulton said, most of the night. And by the morning, and they were up all night with the drums and everything, Fulton had written down every herb they put in, or described it or took a picture. And in the morning, when the sun came up, the healer, the shaman, drank it and touched the woman, who stood up and walked away. Okay, so one of the points I really like to make is we've come to, because of randomized double-blind trials, we've come to think of placebo, at least most of us scientists, is placebo is a bad thing. It's something you have to control when you're doing a double-blind study. But placebo is very important. Was this woman a fake? No. There's a Western medicine study where inappropriately some surgeons in Texas didn't believe that the operation for scraping osteoarthritis knees was not worth it. So they did a bunch of patients with that operation. Some they just cut open. The others they cut open and did the operation. And both sides gave about the same level of improvement. So placebo is a very powerful thing, and it tends to be, I think belief systems are extremely important and very powerful. So let me go on now to just 2 words about how the United States government has responded to this increasing use of alternative practices or whatever. One is in 1994, they passed the Dietary Supplementation Act. This is not the same as an over-the-counter drug. A dietary supplement, and it was led by some people, I forgot the senator's name. His wife was a big believer in this, and he pushed it through Congress, and I'm not going to take a position on it. What it allowed is for something that is a dietary supplement that is always from a natural product, even if you extract it from the natural product, has to be taken orally. And it cannot describe a usefulness for a disease. It can only describe something that deals with structure or function. So for example, if you were to take something that's on the market for shrinking a prostate, it cannot say it will deal with your prostatic hyperplasia, or, but it does say good for your prostate structure and your urination function. So if you read those labels carefully, they just never mention a disease. But the average person, if you read that, you wouldn't distinguish the two, but that's a requirement. They cannot not use those things. The FDA is only allowed to deal with them at all if something bad is happening. So the FDA is out of that. This is totally different than an over-the-counter medicine, even though your drugstores or whatever have them on the same shelf. So unless you really looked, you wouldn't know. An over-the-counter drug is a drug that has been studied and has proven to be extremely safe, so that it doesn't need a physician giving you a prescription for it. So it's really opposite ends of the spectrum of a deeply studied and reasonably safe drug versus something that hasn't been studied. Some probably are good. People are really taken by them. The sales of some of these things are really astronomical. Anyway, that law is still in effect, and it's very commonly used. A few companies, for technological advantage and money advantage, have in fact gone through the testing so they can advertise that our drug has been approved by the FDA or our dietary supplement. The other thing that happened in response, and the timing is very close, it started in 1994 and continues to change a little bit, is the NIH, to support some research in this, actually created first an office of complementary and alternative medicine, and then later made it a center for complementary and integrative medicine. So they flipped that word, which integrative is much easier for the traditional doctor to buy into and to give some space, et cetera, et cetera. A guy named Wayne Jonas is the one who played a role. He was head of both the office and the center, and then went to a foundation. He's a good person. I think the other thing that I neglected to mention in terms of why some of this took off is there were at least 4 physicians who played a big role in this, what shall I say, the promotion of complementary and alternative medicine. Andrew Weil went to Arizona, or is in Arizona, had a really phenomenal, I visited his program just to see what it was like. He gets traditionally Western medicine trained people and teaches them a lot of integrative medicine. He's been very supported by, I don't remember her name, but Bezos's ex-wife. And they're starting a new medical school just about integrative medicine. That will be its main focus. I think it'd be in Oklahoma. But she is just a giant believer and supporter. Other people whose names you know, and they're very charismatic, and they're all physicians, MD people, are Deepak Chopra, Mehmet Oz, and well, I mentioned Wayne Jonas. I've had the chance to be on panels with all of them or visited their places. They're all deeply committed to the fact that human beings need more than what they're getting out of Western medicine now. Now, what is it that that you need? And this is the cost of where we've come with, I think, information technology and all the discoveries and technologies that I'm so proud of for our species having made, but which is coming with a cost. My dad was a general practitioner. Now it's family medicine, but it's a different kind of training. But he graduated from medical school in 1933, opened up a practice. Okay, in 1933, Krebs hadn't yet discovered the Krebs cycle. Certainly, we didn't know till the mid-50s about the structure and reproduction of DNA. the only antibiotic he had, it's actually the chemical, is the sulfonamide. That's all. That penicillin had been discovered, but it didn't become useful till the early 1940s with the motivation of the war. And so all he had was that. And there were some operations they could do, tonsillectomies, appendectomies, but the anesthesia was not good. And the death rates were pretty lousy sometimes. But that's what his practice was. The other thing so what he could really do for a patient was make them feel better, get a prognosis, and give some sense of a medical approach, or someone's with you. But that feeling good part is so critical for patients. And some of the discoveries we've made really don't help the emergence of feeling good in a regular doctor's office. If you're lucky enough to have someone who really cares about how you feel, not just about what your chest x-ray looked like, or objective things, that your white count is high or low or whatever. But people need to feel good. It is nice to feel better. It is nice to have someone support you. And whatever news they have to give, it can be done in a caring way or not. Why was that easier then too? My dad came from an area near Belarus. He was 13 years old when he came to the country. Almost all of his patients came from the same town called Matolev. He knew them all. He knew the families. He was the general practitioner, then was the boss. The general practitioner had the say-so about what the neurologist wanted to do. So it was a very powerful position, but he could see 60 patients a day because he knew them. He didn't have to go through a whole bunch of stuff. It's hard to sometimes get the same doctor each time now because it's on a different kind of business structure of what you have to do. I cannot forget the time when he got home. I didn't see him I was 3 to 8 because of World War II. When he came home, he had decided I was going to be a doctor. So when I was 9 years old, he took me on rounds at the hospital that he had usually 20 patients at or something like that. And my reward for going with him was we would go to see the Chicago Bears play. And so we'd go in the morning and he'd finish and we'd go run to the game. Half the time we missed half of the first quarter. And I hated that because I really wanted to see the kickoff. And we were just about done on rounds one day and we walked into a room and I got to learn a lot from going around with him. I looked at this lady in bed and I knew here comes an hour of the coffee's too cold here. Nobody cares about me, et cetera, et cetera. And I thought, here we go. First quarter is gone. And before she could say a word, he looked at her and he said, "Hey, May, how you doing? And how are those boys of yours, the ones at Harvard and the ones at whatever, Yale?" And she said, "Oh, they're doing well." He said, "Are they going to be a doctor or a lawyer?" And she said, "I don't know. They can't make up their mind." He said, "Well, when one of them comes home for Christmas vacation, I'd like to take them around and show them what a doctor does." And she said, "Would you really do that?" And he said, and he would. He loved to. He really pushed the profession. And she'd say, "Oh, that's wonderful, doctor." And he said, "How's that knee doing? Doing great?" And she said, "It's okay." He said, "I'll see you tomorrow." So he turned a 1-hour conversation into making her feel better, thinking about her sons and not the cold coffee. And then he got out of there, and that's why he could see so many people. Those are things that this would not be doable today if you don't know the whole family and its history. and what they worry about and what they don't worry about. And that's a hard thing to keep in our system right now. But it's not hard to keep in a lot of the integrative medicine practices, because your massage therapist or your whatever. Now, I'm not talking about dietary supplements. I'm talking about the human to human interaction, which is very powerful, and it makes people feel better. If any of you use any of these practices, the ones that involve human beings, they tend to really work hard on on doing something that will make you feel better, and in a nice way, in a good way. Um, so I think that's one of the things, if we could recover, if we could find a way in Western medicine to do that, we would improve the profession and improve the way people see us as doctors. Um, some are, as you know, some of people are much better than others at this. Let me turn now to the area of research, as to how good or bad something is. How safe is it, or how valuable is it? Research in this field, and I've tried to do things with acupuncturists. Um, the one I'm going to talk about is floral essence. But it's the same story in a lot of the adventures I've had in the world, trying to interact. And I mean, it's a tricky thing. The heart of Western clinical research is the double-blind clinical trial. That is the one that we read about now all the time with the vaccines. For Pfizer, you got to get a group of people, some of whom got the inactive material, and some of them got the vaccine, but you had to have those people in there so you could randomize them and see who does better by the time it's over. Well, the randomized double-blind clinical trial is best for big differences, and it's best when there are, but the big difference is that if you have just a small value to the drug, you have to do a lot of patients. You just have to get statistical significance. Statistics plays a giant role in this, and many people don't really realize that it was only till about the 1950s that the kind of statistics we needed came into existence, and also the randomized double-blind clinical trial. So this is fairly recent. How long that will stick is really the heart of clinical research. I think it's going to get harder and harder to randomize people as people like Dr. Burns here learns more about the genetic differences one person to another. And as if you go it far enough, I don't know how you randomize, because you start to know so much about each person. I think we're heading toward a time, not in the next decade, but I think we're heading toward a time where it has to get replaced by N of one, that just one person that you study carefully. Several people, but not in a randomized way, because I don't think we'll be able to randomize in the future. Not many people believe that, but I do. Let me just tell you this story about why this is hard, and then I'll just take questions. There was a woman who practices in Gainesville, practices floral essence. That's not aromatherapy. It's bioenergetic rearrangement of water molecules. Okay, which I sit there and say, you know. What they do, what the practice is you get a certain flower and you put it in either water or tincture, 10% alcohol, and you let it sit there for a while. And then you got to take it out into the sunshine, because it needs the sun's energy to rearrange the energetics of the water by the flower. And to me, this is lunacy, but she had a big practice. A lot of people came to her. A lot of people felt better. And I asked her if she was willing to do some research on that, because I couldn't think of a better setup for doing a study that was randomized and everything. And I asked her what it was best for. What made her heart leap with joy because she knew she'd helped that patient? And she said, migraine headache. I said, okay, are you willing to study migraines with this? And she said, sure. And what my study was to be is just leave out the sunshine. Same bottle, same water, same alcohol. You can even drop the flour in. Well, you have to drop the flour in. And then, but put some in the dark and let the others have the appropriate amount of sunshine. That makes it work. Then you got two containers, bottle A and bottle B. And bottle A has the sunlight, the bottle B doesn't have the sunlight. She wouldn't know which is in bottle A or bottle B. And someone else would give her the sample and monitor what it was. Um, and then she said, oh, that sounds good. We'll do that. And then we'll see if the migraines are better in the group that got in the sunlight. And just as we were going to start that, she said, I can't do it. I cannot deprive my patients of feeling better. I said, can you deprive them for 1 week? How long before you know whether your treatment worked? And she said, 2 days. And I said, well, they wait a week? And she said, yes, because most of them have waited 2 or 3 years with you kind of doctors before they come to see me. So I can wait a week, they can wait a week. And then she said, well, okay, then I won't be depriving anyone. And I said, in the study, it would be very easy because all we do at the end of the study is say, did you switch everybody to A or B in their case for the sunshine or the other? So if it came out 50-50, it didn't work. But if 100% of the people ended up on the one with the sunshine, I would sit there and be flabbergasted. But I would have to sit there and say, we should look at some other aspects of this. And then we were getting ready to start. I had written up something for the investigational committee. And then she said, I said to her, if we do this and it shows that the sunshine had no effect, will you believe it? Because I always ask people I was going to do in acupuncture and elsewhere, would you believe it? And if they were to say no, I'd say, well, what do we have to do so you would? And the answer I consistently got was, oh, I don't know how many times because I know it works. I do it for a living and I do it all the time and it works. My patients feel better. And I sat there and came to realize, first of all, they do feel better. I talked to a couple of them and they feel better when they see her and they get this stuff to drink. That's what you do with it. And I ended up really thinking one night, is it my right? Am I inadvertently stopping some people from feeling better by doing that? I don't know the answer to that question. There's a part of me that says the truth is really what it's all about. So if we can get to the truth, that's the right way to go. On the other hand, I sit there and say there's stuff that these people have that we don't have other medicines. They've all seen Western doctors. And she makes them feel better. So that's where my perspective is. We don't know how to deal with this issue. It's a very hard issue. Some of this stuff is horrid. They're just pushing it for money. But stuff like, I'm a regular devotee of massage therapy. It relaxes me. I'm sure it's kept my blood pressure lower than it would have been otherwise. I don't like to take too many dietary supplements. I have on occasion, but let me just open it up for questions. it's a tricky, tough field. Make sure that I got some of the stuff I wanted to do. That's it. That's it. So.
Thank you. Questions first we'll take from the Oak Room. Anybody?
I was just curious, did you go on with the study about the aromatherapy? Did you actually follow through and do that then?
With the
With the A bottle and B bottle, the one with sun?
no, I did not, because I just can't work with someone who isn't going to believe in the results of a well-done scientific study. Because I am, in the deepest sense, a great advocate. This is why I tried to say at the beginning. My belief system centers on science. Not all the science things are easy experiments, but because I felt I was wasting my time. Because she probably wouldn't want to be a co-author of a paper that said what she does for a living doesn't work. So I just, and that other part of maybe I was thinking of my dad and how he made a lot of people feel better in his life, a lot. He really knew how to deal with people that way. And I've never heard him say a bad word about anybody. I mean, he was very, to me, I didn't appreciate that when I was younger, but he was a very honorable man. And I really thought a little bit about what he would think. And he was so into working with people to make them feel better, that I was going to deprive some people with migraine who felt better because they saw this person. Belief system is so important. What you believe in before you start any of this. Over the whole history of science, I mean, we believed we were the center of the earth, center of the universe, the earth, and a lot of people did not like the results of the science, a lot. And a lot of major religions didn't like that. So when we go over the whole history of beliefs, the belief system, and I would apply that straight back now to the pro and con Trump people, is your belief system puts you in a category, and all the reason in the world doesn't seem to move anybody, maybe a few people. So it's the power of that and the power of placebo that I really want to convey. They're both placebo can be very helpful. It's illegal for a doctor to do a placebo without telling the patient, but when you tell the patient, it's no longer a placebo. But I can't have a patient that I think would respond to a sugar pill. I cannot give them a sugar pill and not tell them I'm giving them a sugar pill. And I can understand that too. These are the quandaries in fields like this. It's hard.
I feel, Alan, I feel that homeopathic medicine, which in India, there are a lot of believers. I'm not one of them, but I feel that that's the placebo effect, or faith, or just belief. It works for some, and then those who don't believe in it, it doesn't work for them.
They're absolutely, I couldn't agree with you more. I actually spent a half a day with a homeopathist practicing in Gainesville. And I wanted to see what he did. And we started talking, and I enjoyed the time with him. He's a charismatic person. And I said, what do you do if a kid comes into your office with meningitis? I mean, you really trust your delusions and all that? And he said, well, if the child really has pretty flagrant meningitis that I think is bacterial, I send them right over to Shands or to UF or to North Florida. he said, but 9 out of 10, I don't think they're that sick. So I give them some homeopathic remedies and they go home and I have them call me if anything gets worse, and they call right away. And then I see them the next day and almost all of them are better. And I said, well, geez, I took care of a lot of kids that way too. But I didn't say that I thought, I didn't say I was going to do anything to help them other than pain or whatever, fever. I, but I said, I think that my intuition said they weren't that sick and it was viral. So I didn't do, neither of us did a lumbar puncture. He doesn't do them. I didn't do it, but gave the same advice to the patient. Call me right away. Da, da, da. And all of them basically came back just like his came back, better. It was viral and it played its day or so and was gone. Not all viral ones go away right away, but that we couldn't do much about anyway. And I said, so I don't know that it had anything to do with your homeopathic remedies. I believe that something in my acumen as a diagnostician said, I don't think they're got bacterial, and I'm going to watch for a while to avoid the lumbar puncture. And but I didn't attribute it to anything that I did other than making a judgment. But he said, well, you're wrong. It's because of my homeopathic remedies. So I couldn't agree with you more that in that practice, they're honest. They believe, well, I guess most of them are honest. They believe what they're saying, but it doesn't fit with what I believe in or what. And I said, so I think you were just seeing the same thing I did and you just decided to wait. He said, well, you're wrong. I said, okay, what are you going to do?
Well, so there's a comment here. Would you like to read that? Comment on it?
Yes, what it is I taught anatomy at an osteopathic med school. I also taught nonverbal and verbal communication between doctors and patients. They also taught manipulative therapy in addition to modern medicine. I was treated at the University of Vermont Med School with modern med and additionally approved herbals. They have a department to study this. They follow the reaction of each patient. This integration is amazing. My response is I think that's great. I think we have to have people doing inventive and appropriate things. I do know, and you I imagine know better or more modern stuff than I do. I've been retired for 14 years, and it probably is obvious to everybody in this room. This is the first talk I've given in 14 years about anything. But to the best of my knowledge, when I retired, fewer than 20% of osteopathic medical school physicians practice manipulative therapy or practice that part of what they learn. Many of them reintegrate in residencies in traditional allopathic medicine. So there are 20% that still follow that piece of what they learned. And many of them that I know are really good doctors. I mean, so I'm not in any way doing, but 80% of them have chosen not to continue that field of knowledge that they had learned.
Are there questions on?
Yep. Shirley Bloodworth, go ahead.
Hi, Dr. Neims. Very, very interesting. I wonder if you feel the same way about hypnosis, or what is your thought about hypnosis?
Hypnosis?
I left out a lot of the whole psychiatric and other approaches to some of the psychologists. I'm going to answer that in a strange way, just by a personal experience. I don't have enough experience to speak of studies or anything. I will say that when I used to, Dr. Schiebler, who has immense influence over all human beings and creation, would have me attend and be a teacher in July when the new house staff would come in for about the first 5 or 6 years or 7 years that I was at the University of Florida. Um, and the last time I had unfortunately 3 2-year-olds that drowned. 2 of the 3 were under the care at the moment of a grandfather who went in to answer the phone, thought he'd be on the phone for a minute, and when he came out, the kid was face down in the pool, 2-year-old or so. And my job, and all 3 of them were dead, but they put them on, I mean, not inappropriately, they put them on before they knew they were brain dead and everything, and the kidneys were failing and the liver was failing. They put them on a respirator and things like that. And my job is, honest to goodness, every day when the work day was done, I'd go over to a Holiday Inn on the corner of 13th and University and meet with the parents who were filled with anger at the grandfather and pain of losing a child. And the poor grandfather, you can imagine how that felt. And after a week or so, and my job was to try and convince them that it was time to unplug the machine. And after that, I told Sheebler I was never going to attend again. I wasn't ready to be able to deal with that. It just hurt so much, partly because I had kids myself. And but I did some personal growth things, a lot of them. So what I like to kid and say, I went through the 70s and the 90s without psychedelics. Never got into that. But one session I went to in Tampa with Ram Dass, and Ram Dass was that guy from Harvard who went over, I forgot what his real name was, but he made it Ram Dass, and he studied with gurus in India for a long time. And it was a good workshop. And then it was a Saturday of learning, and Sunday, he said, today we're going to start with 2 hours of saying Shri Ram, Jai Ram, Jai Jai Ram. And my first inclination was 2 hours of saying that same thing over and over and over. But I did it because the room was beautiful and the voices were nice. And sometime into that, I have no idea what happened, but I went somewhere else. My mind went, and it was beautiful. I mean, I won't bore you with what I saw imagery-wise. And then he rang the bell at the end of this, and it was ecstatic. And the bell rang, and I woke up, and my first reaction was, God, the serotonin must have got mixed up with the acetylcholine. And so I was going to interpret this as chemicals getting screwed up. But people that saw me for the next 2 weeks said, God, what happened to you? You look 5 years younger. And it was that big an experience for me. I've subsequently learned that many, many people have it at an early stage of this kind of, it's not exactly hypnosis, but there are different states of consciousness.
Is that meditation?
Yes, yeah. But I would imagine, and this is just me speculating, that parts of hypnosis get close to that place in a different way. And yes, there are things going on in this. I mean, what is it? 5% of what our brain does is conscious or something like that. 95% of what it's doing. It's an astounding organ. Good
We have a
Brain
question
Institute.
here.
More a comment. I've been treated at Integrative Medicine here at UF with Dr. Astores, and a couple of different treatments were tried. Some did not work. Hypnosis happened to be the one that did work. She would read to me, and you go into a sort of trance, but she had a regular script that has been done medically by studies at some university in the Midwest, I believe. And it was a very successful thing. It took several treatment sessions, And then she recorded on my phone so that daily I could do it at home with her speaking. So it was very effective for me.
That's, I'm glad you found something. It's,
You told a story about your father who was talking to this lady and asked her questions, and then she felt so much better. Two things. First of all, your father knew the whole family and knew the familiar situation, so he could talk about it. And the other thing is he had the time. How many physicians these days have the time to talk to a patient for half an hour? It's usually 15 minutes. You get a prescription and you're out.
see, what I wanted to convey, and I guess I just didn't say this piece of it. When I said he could see 60 patients a day,
Yeah.
which he did, that's more than they require people to see now.
Yeah.
And that's because he knew them so well. He knew whether this is someone I can spend 2 minutes with, because they're okay. They just need something.
Mm.
And then there were some people he'd spend 2 hours with because they needed that. But you can't do that if you don't know the patient and their family and their life history. And so that's something that we don't get much anymore. I mean,
Yeah.
I understand it. I understand the business model. But it just has left a little bit of a void that people need. And I was using that just as an explanation of why so many people find some of these approaches just what they need. And the actual concept of doing a randomized double trial on it to get it proven doesn't sit well with me. There are some things in this world that science is not about. Like if I say, do you love your mother? And you say you did, and I say I did too. Who loved their mother more? Well, that's an absurd question. And and I think there are things in this world where science is not applicable. The obvious one that people talk about all the time is science cannot deal with, is there a God? In my opinion.
Here's a question.
The question is, in our litigious environment, are practitioners of alternative medicine at higher risk for malpractice suits? I think by and large, much less by tradition. And we could also sit there and say, because most of those practitioners are really, they're friends. And it's well known that if a patient and a doctor have a good relationship, the amount of litigious activity is less. So I think so. And you know, and my wife is a therapist, and it's not alternative, but the fees that she pays for insurance are trivial compared to what a doctor pays. Doctors are perceived of as very well-to-do people. I would think the most litigious activity would have to do with a product in the chemical range where you're not dealing with another human being at the other end, you're just buying it off the shelf. And many of the medicines from the East really came for a long time contaminated with heavy metals. So I would imagine there have been some lawsuits, but I don't know that. So I think it's not been a traditional thing to do, but if we say it louder again, they'll probably get started.
We have a question here.
I just have a comment. I have a very good friend who was a very anxious flyer and would almost not do anything to avoid flying. Sort of serendipitous, she ended up in a very long hypnotic session, and it was sort of therapeutic because they took her all the way back to the fear of flying, which she saw a plane crash, and her father died shortly after. So in her mind, she had the two hooked together, and she now flies everywhere. So for her, it worked.
That's very good. You know,
Thank you.
this belief system and these deep memories we have are very powerful, and they influence our lives. Like, I mean, I just smile at little things. Every time I look at Ken, we've interacted a lot over the years, including in Baltimore. And the funniest moment, if we need a little bit of humor, is one day I showed up. I was a resident. He was a first-year resident. And I heard him yell something. What I heard was, what did the Sox do? He's a big Cleveland fan. I'm a Chicago White Sox fan. And we used to joke and kid and whatever. And what I heard was, what did the Sox do? So I said, they won 3-2. And he was actually asking, was magst du? And I was answering, what did the White Sox do? So, you know, I have a great respect for what our brain is doing all the time. And much of it we're not quite aware of, or not aware of at all. And so, you know.
Question. With osteopathic medicine and other alternative medicines, do they rely at all on diagnostic testing like your traditional Western physicians do? Blood tests,
Yes,
EKGs, et cetera?
You know that yes, they really go through they get a lot of allopathic medicine, regular medicine, but they get the added piece. And some of the best physicians I've ever met I even put it in parentheses, I don't even call osteopathy an alternative practice. It's people who really are trained as regular physicians, and some of the best physicians I've ever known were DOs, not MDs. And most of them are really practicing as, I mean, there are a number of medical staff members at UF that are DOs, doctors of osteopathy. So I don't even consider that as an alternative.
Do we have any more online? Any further comments or questions? If not, I want to thank Alan for taking the time and coming out and being brave enough to come out this morning. I also want to mention that Alan has been very, very helpful to me in organizing this series. He suggested several of the speakers and put the program in perspective for me. So I am very thankful to him for that, and thankful to him for coming. Thank you.
I suggested the good speakers. Yes. No, I'm kidding. That was a joke.